going to learn, I am going to actually demonstrate you the terms of movement. Now the terms of movements are actually defined by the words. Okay, that's why they are called as the terms of movement. And these terms of movement, they come in pair with the opposite meaning, as I have taught you also during the movements of terms of position, that those terms of positions were also coming in pairs and they were having the opposite meaning. The same thing is here for the terms of movement. The first term of movement is in pair also here, and it is flexion and extension. Now this movement, if I demonstrate you at elbow joint, this movement is flexion and this movement is extension. Now this movement is taking place in sagittal plane. So by this time you know what is sagittal plane, what is the median plane, and right angle to it. This is the coronal plane. So this movement is taking place in sagittal plane, where the two flexor surfaces or the ventral surface of arm and forearm, they are coming close to each other, so that the angle at the elbow is reduced here. Okay, so this is the movement of flexion, and from here if we go back to the normal position, this movement is called as extension. Here the angle is increasing and two surfaces, ventral surface, they are going away from each other. Okay, so the two dorsal surface, extensor surface, in other words, they will be coming close to each other. Okay, so this is the movement of flexion and extension at the elbow joint in upper limb. But at the same time, if you see the flexion and extension in lower limb at the knee joint, then you will see that here the leg is coming closer to that of the thigh, so that the posterior surface or the dorsal surface of the leg and that of the thigh, they are coming closer to each other and angle is reduced. This movement is also taking place in sagittal plane, similar to that of the flexion and extension at the elbow joint. Now then, there is a difference. One is taking here in opposite direction. Both are taking place in opposite direction, and the reason for that, okay, you will understand better. Okay, I am not going to tell you what is the reason why these are movements in the upper limb and lower limb, they are taking place in opposite direction. Now come to the flexion and extension at ankle. Now here, if we move the dorsal surface of the foot, because I have already told you the dorsal surface, that is the dorsum of foot, and the opposite surface, that is the sole, is the plantar surface of foot. If the dorsal surface of foot is coming closer to the anterior aspect of the leg, okay, they are coming closer to each other, then the angle is reduced, and this is defined as the dorsiflexion, of course, because the dorsal surfaces are coming closer to, so it is called as dorsiflexion at the ankle. And then if we move it oppositely, so that the sole is going towards the ground, okay, that movement is called as the plantar flexion. Now this dorsiflexion and plantar flexors, which are taking place at the elbow, at the ankle joint, they have to be performed when your foot is off the ground. Okay, you cannot perform when you are standing on the ground with that leg. Okay, I will say with that lower limb. So this is the plantar flexion, and opposite will be that of the dorsiflexion. Now coming to the second term of movement, that is abduction and adduction. Now this is usually defined in relation to the limbs, and this takes place in the coronal plane, okay, which is at right angle to the median plane. When you move your upper limb away from the median plane, this is our median plane, okay, and you move an upper limb away from the median plane, this movement is called as the abduction. Okay, and when you bring it back to the normal anatomical position, this is called as the adduction movement. Okay, so this is abduction and this is the adduction. Same is true for the lower limb, abduction and adduction. Abduction and adduction is there. Now, in case of the hand, the movements of fingers, this takes place through a finger axis which is passing through the middle finger, and if I perform the abduction, the fingers will be moving away from the middle finger. That means the thumb and the index finger and the ring and the little finger, they will go away from the middle finger, which is stationary because the axis is passing through it. So this is the abduction and this will be defined as the abduction. Same is true for the toes of the feet. Okay, in foot the axis passes from the second toe, okay, and then the toes they spread up in relation to the second toe, that is the abduction of toes, and then the adduction of the toes, right? Then I will define the inversion and eversion. Inversion and eversion, again they are in relation to the foot, and in inversion, okay, you have to raise the medial border of foot, okay, so as the sole faces medially or towards the median plane. When the sole will face towards the median plane, so suppose this is my left foot and this is the medial border. If I raise the medial border of the foot, the sole will face towards the median plane. So this is called as inversion. And then from the anatomical position, when I will raise the lateral border of the foot, so as the sole will face laterally, okay, away from the median plane, then it is called as the eversion. So this is inversion and eversion movements are there. Now the movement rotation, which are opposite in medial rotation and the lateral rotation, usually they are in relation to the limbs. Okay, the medial rotation will be defined as, say this is the flexor surface of the upper limb of the arm and the forearm, okay, and when you rotate this upper limb here like that, so that the flexor surface are facing towards the median plane, then this is called as medial rotation, and opposite of it will be the lateral. Starting from the medial, anatomical position, if you will rotate the entire aspect of the forearm, then this is the lateral rotation of the arm. So medial rotation and the lateral rotation of the upper limb. Same will be true for the lower limb, medial and the lateral rotation. What is pronation and supination? The opposite term. When you stand like this in anatomical position and then you turn your hand so as the dorsal aspect of the hand faces forward. This is called as pronation. So when dorsal aspect of the hand after rotation faces forward, that is the pronation movement. And when opposite of this, when it rotates so that the palmar aspect of the hand faces forward, this is called as supination movement. So they are opposite. But then pronation and supination is also described when you semi-flex the elbow. This is elbow joint, and when you semi-flex the elbow, and in this condition, this palmar surface of the hand is facing towards the roof, and this movement or this position is called as supination. And when you rotate it, so that the dorsal aspect is facing towards the roof, then this movement from supination to this position is called as pronation. And again, when you go from pronation to this position when it is facing towards the roof, this is called as the supination movement. So supination and pronation movements are there. And then we come to a free movement, which usually takes place at the joints, and especially in the shoulder joint. This is called as circumduction. And circumduction movement means here the main movements will take place and the arm will move in a circle. Say for example, when you are throwing the ball in cricket, okay, you hold the ball in cricket and try to move the hand, this ball, okay, in the form of a circle, and these movements are taking place at the shoulder joint. So this is how you begin. This is the extension, abduction, then adduction, and again come to the flexion. At the same time, when these movements are taking place, you are also rotating slightly to this upper limb, holding the ball in your hand. Okay, so this is circumduction movement is also possible at other joints, especially in the hip joint, but here this movement is restricted, not as free as it is in the shoulder joint. And then I will come to the last few movements. For example, when you count, you are touching the tip of the thumb with the tip of the finger. This movement is called as opposition movement because two tips are opposing each other. Okay. Then there is a movement which is called as retraction and protraction. Let us see first protraction. So this is my lower jaw, and if I protrude it anteriorly, this will be something like this. This is called as protraction or anterior movement, and bringing it back to the normal position, this movement is called as retraction, opposite of protraction. Similarly, I may protrude my tongue and retract it back, okay, to the normal. So this is protraction and retraction. And the last movement which you may have to use in your studies is that when you move your shoulder up, that is elevation, and when you move it down, then this is called as depression. So elevation and depression, these are the movements. So what you have learned today are the different movements which are possible in the joint, and they usually have the opposite meaning. Thank you.